Big news in the headlines today saying there is a global fertility crisis based on a recent report and analysis by The Economist. I'm Dr. Lucky Seacon, a New York City-based fertility specialist, here to break it down for you. What the report is referring to is the fact that across the board in the large majority of developed nations, women are having fewer children over time. The fact that we are living longer and we aren't doing as good of a job of replacing ourselves as our population ages because we're having fewer children is a problem for the economy. Who's going to work and support the economy? Who's going to look after the large swath of the population that will be retiring in decades from now? So these developed countries are now coming up with strategies and ways to try to incentivize people to have children to replace the aging population. Here's some interesting data. The large majority of the decline in the birth rate per 1,000 women in this country was mostly attributed to younger women. There were far fewer teen pregnancies as time went along, which I think we can all agree is a good thing. And even women in their early 20s had fewer kids as time has progressed. There has been a steady rise, however, in the number of live births in women over the age of 35 and over the age of 40. Education and socioeconomic status plays a huge role as well. For instance, college-educated women are having children several years later than earlier generations, but they're having the same number of children overall. They're just starting later. Whereas younger women with lower socioeconomic status and less education were waiting longer to have kids, and they're not having as many. As a fertility specialist, I find looking at these trends fascinating, and I know that there's a complex interplay of so many different variables that are leading to this trend we're observing. As someone who has discussions with patients every day while they're navigating their planning and when they're ready to start building their family, I can tell you one thing, which is it's going to take a lot more than a one-time baby bonus to incentivize people to have more kids and to have them earlier. We need more support. We need affordable childcare. We need paid maternity leave. Lower healthcare costs so that it's feasible to support ourselves and our families. And when you look at that statistic about women delaying their average age of first childbearing, that's not shocking to anyone. We know that society has shifted. We are equals now in the workplace and when it comes to education, and we have a lot of things to accomplish, so we're waiting longer to start our families. But not everyone has access to the necessary health care. Not everyone can afford to freeze their eggs or seek out the help of a fertility doctor and undergo treatments like IVF, which can be very effective at overcoming age-related infertility. And I think that if we want to take this issue of declining birth rate seriously, that's what we really need to be focusing on.